Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan. We're here with our returning guests. We have Dr. Tommy John out of Chicago, Illinois, and Dr. Ruvayn Rubinstein out of Troy, Michigan.
Thank you for having us.
Glad to have you guys back. So last time we were on the show, we were talking a lot about sports and how athletes should be under chiropractic care to increase overall performance and prevent injury. And some of the reasons, what I'd like to talk a little bit about is some of the core muscles. It's kind of a buzzword that people throw around in general. Is strengthen your core workouts. You look it up, on YouTube, Jillian Michaels core strengthening, and it's a common word. So let's just talk a little bit about what people mean by core.
So the core, typically what the public will think of is the abdominals, the six-pack, the typical six-pack. But it entails so much more than that, and it's almost described as a separate entity, and it's completely, couldn't be further from the truth. The back has 4 layers of muscles. 4 layers of muscles. That means there's a lot of control there, as we know with the spine. The only other place in the body that has 4 layers is the foot. These are 2 very, very hugely important areas for proprioception, for movement, for posture, for locomotion, for everything else. But everybody thinks that the core, quote unquote, will work by itself. A core opens the door, a core hits the baseball, a core lifts a 2-year-old. Your core is just a transfer of energy from your feet to your hands and your hands to your feet. Therefore, anything weak along that chain will break down. So I have seen people who have predominantly just been core oriented and have had bad hips, knees, and ankles, or bad shoulders, elbows, and wrists. So it's all together, but to transfer the energy that you need from the ground up and from the hands in, you need a very strong abdominal region, yes. Up on the sides here, yeah. And then mostly all 4 layers of the back. That's something that just gets kind of pushed off.
Most people just think of the abs, the six-pack, because it's showy, it's sexy, but you're using core muscles constantly. Anytime you're even just sitting up, you're constantly using your muscles. So let's say you have a baby, you have a 2-month-old baby, you can't just sit them up, they're just going to flop right over. Their core muscles aren't even strong enough to hold them up. But as an adult, we are. Even when you're laying down, you're using muscles all the time. And so by keeping the muscles in great shape, in the right position, keeping the spine aligned healthy, we prevent some injury with not just the core, but the joints that are promoted there.
I mean, before I went to school, I'm from Miami, Florida, so those six-pack abs are talking. I mean, you go to the beach every day, you get people, they're doing push-ups before they go to the beach to look good when they get to the water. So, I mean, before I went to school, people think core, you got to have that six-pack abs. You got to look good for the beach. You got to look good for the ladies. But after going to school and learning the anatomy of the body, you realize, wow, these people don't realize what they're doing to their body by just working out one part of their body. It's a whole kinetic chain. If you don't take care of the whole chain, there's going to be problems.
Absolutely.
So how does keeping a strong core help to prevent injury?
So honestly, it allows the training of other parts of the body to be more efficient, more appropriate. And then the body can then adapt to whatever the stimulus is that you're giving it, whether it's a band or a weight or a water. I guess people are exercising in water now, and there's air-resisted items you can use. So we're trying to get all these things that we see very, very strong. But again, they work off of a stable, grounded system starting from the feet up through this center piece and then out. And if this is weak, if there's anything along that chain that is weak, then you're going to get a pattern that's going to run down into the arms and legs, and it's going to be a faulty pattern. And you may look good, and it's literally like thinking of a Ferrari with a moped engine. You look amazing, but your output is not anything. And not just sports. I'm talking about, again, pushing a grocery cart. Getting up in bed. How many times have you heard injuries? These injuries happen where they're tight in their shoe.
They were just going to pick up a candy bar, and bang, they hit the ground.
I was doing the lawn work for the last 30 years, and today, boom.
Drop the car keys.
Or I sneezed, and all of a sudden I blew out my, so we're absorbing force at constant times throughout the day, interacting with our environment. And this whole straw that broke the camel's back, well, as we know with degeneration in the spine, the tip of the iceberg, the whole thing started 20, 30 years ago, depending on the age of the person.
Before.
Absolutely.
Yeah. So how does some of the core, and keeping the strong core, affect the spine itself?
So honestly, it'll protect it, because the whole thing with with what the force absorbers of the body, whether it's a handshake. When I shook your hand today, why I didn't dislocate my shoulder? Because my muscles turned on and absorbed the force, so they didn't go into joints, bones, ligaments, discs, fascia, all these things not designed to absorb extreme amounts of force, therefore holding structure. But the muscle itself will protect the force from going into structures not designed to absorb force. So having a strong core, or having a strong 4 layers of the back, along with the breathing muscles, the abdominals, the transverse abdominis, and the obliques and everything else, will protect that system, protect that structure.
So I know we have a video clip with some specific core exercises that where you're going over that with some of your clients, some of your patients, and we'd like to play that clip and see what it looks like.
Go. Opposite. Yes. You can put your head down. There you are. I'm sure the floor is clean. Just try to lock your arm out and your leg out. There you are. Exactly. Yeah. Just shows how much brain power it takes just to do a cross crawl pattern. Good.
Okay. Well, we just have a rebound front plate raise, grabbing the plate at 10 and 2 o'clock like a steering wheel. You're going to throw the plate as high as you can. You're going to grab, fire down into the top of the plate at that 10 and 2 o'clock position, and then quickly try to reverse the direction of the plate in as small of a distance as possible. So you're trying to accelerate into the plate as fast as you can, as much as you can generate, as much force, and then change the direction of the plate once you absorb the force of the plate. So this will look something like this. You'll see one of the tricks, one of the skills to doing this is trying to keep the plate from rotating or tilting towards you, because it's very hard to grab the top of it when it's flipping. So there were a couple there where I misgrabbed, but that's all part of that. But it's maintaining. You'll see if you don't engage from the ground up, if I try to relax my feet, my glutes, hamstrings, I mean, it just immediately pulls me forward. You've got to engage. You've got to create from the ground up and then from the hands in. Everything starts with the hands and the feet. Rebound, front plate raise.
So that last one was really impressive. That was really cool. Should I go home and try that?
Absolutely not. That is a more advanced move. That was just something to demonstrate how it doesn't take a lot of weight to end up generating a lot of force into the body and creating adaptation.
So if someone just did that and they'd never done it before, what's going to happen to them?
Chances are there's going to be some breakdown and some inability to absorb force into the muscle. And it's going to go into structures not designed to absorb force, like discs,
They're going to rip back
joints,
muscles.
and
And
you're going to have some serious problems.
So how long did it take to progress to get to this sort of exercise?
So typically, what I would start with in the system that I have, so that was called a rebound. So you would take the plate you saw there was a 22-pound plate, but you throw it from a height, and when you catch it, it's a lot more than 22 pounds. Much like if I threw a baseball at you, it's 5 ounces, but when it hits you, it's a whole lot more force because of the speed of it. So it would take time to learn to hold position of that plate, engaging and communicating and sequencing muscles from top to bottom, bottom to top. And then once position's held, then you move to a movement. And you can progress that way. Some people like to fast forward the whole thing, getting impatient, and that's when training injury results.
Can happen, right?
And injury shouldn't happen from training. It should be very restorative and regenerative.
Let's talk about the first one we just saw there. Tell me a little bit about that exercise and how that is helping someone or affecting the core.
Honestly, that is literally one of my favorite exercises as a trainer for the last 12 years, as a sports performance specialist, as a rehab specialist. It's something I do on a daily basis. They're called cross-crawl Supermans. Cross-crawl referring to the pattern that is ingrained from the moment you are on the floor learning how to crawl. Your right arm will go forward, your left leg will go forward. That's the pattern that happens when we walk. Unfortunately, we're not doing these on a daily basis. We're moving less and less, so we're forgetting how to do the cross-crawl pattern. Not like you see people just frozen, I forgot how to walk, but it's inefficient, and over time, it will lead to some sort of a breakdown, some sort of a symptom problem. Well, what I do is I'll throw clients down, face down, and then what they'll do is they'll raise a right arm and a left leg and the left arm and a right leg. It's the same pattern we have in walking, but you're conditioning those 4 layers of the back to train, to get strong, to prevent force coming into the spine, plus what lifts the leg, the big primary mover of the leg that's weak on everybody because we're sitting on it right now. It's the gluteus maximus, minimus, medius. There's 3 of them. That'll train that as well, and then the upper shoulder. So what I found in just historically over the course of 12 years treating people and working with people, their breakdowns are in their shoulders, their hips, and then the anterior part of their lower leg. This is one exercise that addresses all that. And then it's not what the exercise is, it's how it's done. So doing 10 of those, probably not going to do much. Doing 3 sets of 10, probably not going to do much. How many steps do we do a day? Now the big heat is 10,000 steps. You got to take 10,000 steps a day. Fine, but you better be prepared to take 10,000 steps a day. So could it be asking too much to ask somebody to do 5,000 repetitions of cross-crawl Supermans? Not at all if we're walking 10,000 steps a day. Or if we're going to run in miles, there's 2,000 strides in a mile. I'm just going to go run 8 miles. You're going to take 16,000 somethings today. Then we're going to train 20,000 somethings.
So how long does it usually take someone to do 5,000 repetitions of cross-crawl Supermans?
Gosh, so what I do is with people is I'll have them do 5 minutes, 5 minutes of work, and then what they try to progress to is getting no less than 250 each side. So it's counting 1, 1, 2, 2, 3, 3. So you can have the strength endurance to get 250 in that 5 minutes. And then you'll times that out where 250, and I'll typically say, if you can get 250 in uninterrupted 21 sessions or so, that's right around, you're going to be doing pretty well. Things are going to be looking good. And to lead into what we were talking about before, when you come to a chiropractor, the point of this whole thing is to hold your adjustments. So you don't need to be adjusted. Would you hold your adjustment better if these things are working better, these muscles? Yeah, that's what we end up seeing.
Now, not just the musculoskeletal, but does this affect the cerebellum and neurological components as well?
Absolutely. So what we've got when we're moving a right limb and a left limb at the same time, you've got both sides firing at the same time. So what's super interesting is you'll see, I had a hockey player, he's with the St. Louis Blues, took a history, 7 concussions. 7 concussions, man, that's quite good.
A lot of damage.
What's going on? I mean, he's standing on 2 legs, he's able to articulate, he's a smart kid, okay? So as he progressed through the training with the trainers that I got up in Chicago, we end with cross-crawl Supermans, kind of as a mop-up, but as a neurological kind of a enhancer. And so we sit there and you'll watch, and the person starts off with right arm, left leg, left arm, right leg, and they go, and they go. And then all of a sudden, instead of this movement here, you start seeing them do this. And they'll get confused and will have no idea they're doing it because they're face down. And then you'll stop them, hey, right arm, left leg, and they're like, what was I doing? They literally forgot that natural movement. And might they forget it when they're walking? Yeah, but it doesn't manifest right away to where they just collapse and fall. But are we seeing people step off curbs and walk and all of a sudden like something grabs as they're just casually walking? Yes. Might it have something to do with the neurology? Absolutely.
Absolutely. And this is something that, like you said, babies start this right when they're learning how to crawl. It's very important for their brain development before they're adults to keep that healthy brain development. So even with kids, something I do with my baby all the time is I take one arm to the opposite leg and just get that cross crawl going, get the neurological component firing as well as we can.
And even in adults, I mean, with major brain traumas, I know the first thing they have them do is they have to retrain them. They have them do these cross crawl exercises to retrain the brain to be able to remember, okay, I mean, an adult, they've been walking for 35 years of their life.
Right.
Now they had a brain injury, and then they have to retrain everything. So they have to restart as if they were babies. They want to make sure those neurons are firing from left to right and right to left so that the person can start developing better after a brain injury.
Absolutely, and then bringing in chiropractic, not just from, okay, what exercise do I do chiropractor, but the signals coming from cerebellum, from the brain, down the cord, down the brainstem, down the cord, and out. Well, if there's interference because of a misalignment, we can do all the exercises in the world, but are they going to be as effective? No, and it's not a toggle switch. You're not sitting there watching somebody paralyzed, dead on the floor. Oh, you can't move, therefore your subluxate, you're interfered with. But all the more reason to go, first and foremost, before going to do any kind of training, get your spine cleared by a principal chiropractor.
And like you said, as far as it doesn't have to be like a toggle switch on or off. So I use an analogy all the time, just like a fuse box. You know, you look at a fuse box, it's on or off. If someone has a misalignment in the spine, we don't even have to have direct pressure right on the nerve system. It can just be slight misalignment causing inflammation, which can cause irritation in some of the neurological structures and inhibit function, inhibit signal through the nervous system. Now, we keep using the word misalignment. Now, as chiropractors, we have a fancy word that we like to use in place of misalignment, which a lot of laymen don't really know this word or haven't understood this word. And I like to use it as an analogy like the word gingivitis. Most people have heard the word gingivitis. 100 years ago, when dentists would talk about gingivitis, people had never heard of it. So our word is subluxation, right? A lot of people now have heard the word subluxation, but many people have not. And so an easy way to describe that is most people have heard of the word dislocation, right? Think of that like a ball and socket joint. You pull it right out of the socket, it's now dislocated. One step below that is what we call luxation. One step below that is what we call subluxation. It's a minor misalignment in the spine. I say minor, but the implications are major.
Yeah, I mean, you can use the word minor, but like you said, major things are happening. If the signal from your brain to your body, I can't pick this up right here, right now, and hold this out like this, if the signal from my brain to my arm wasn't telling me to do it. The muscles being controlled by the nerves going to it. I mean, people take it for granted. Oh, I just lifted a 2-pound piece of bone right there. I'm not taking it for granted. I know that it took a signal from my brain going down my spinal cord, out my arm, to my hand to be able to lean over and pick it up. If that signal is being interfered with, I mean, this may feel like 10 pounds and it's only 1. But overall, you want to make sure that those signals from your brain to your body have no misalignments, no subluxations in the spine, so the signals are free flowing without any interference.
So instead of it being 100%, they're living at 98%, and then the next year functioning at 95, and then next year and it's 87, and they're down, and they're almost just kind of, they don't know what 100% is anymore. They don't know what it's like to fully function, clear, connected from brain to everything in the body until they visit somebody like a chiropractor, like how, and who practices what we're talking about. And so then to educate them that, I know that you seem like nothing's wrong with you. I know that you're functioning at, let's just theorize, 84%. What would it be like to be at 100%?
And let's say this person is functioning at 84%, 93%. Will they feel that most of the time?
Typically, no. No, you know. Because if they did, they would have been in sooner. They would have done something about it.
They would have crawled in the office.
Yeah,
they would have thought about it. Right?
Exactly,
Symptoms are usually what drive people to do anything. Right?
How many times have you gotten on a history and you're looking and it's like, oh, my back is killing me, doc. My back is killing me. My back is killing me. Okay, and you take a complete history and it's, you also wake up 10 times in the middle of the night. You also have like migraines, 30 a month. These aren't
usually not just one thing either. With symptoms.
No,
right, exactly.
It's this whole smorgasbord of stuff. It's like, this is what we're talking about. I know you're in here and there's pain. That's like 10% of the deal, though.
And the majority of the people walking around think that these things you just mentioned are normal.
Absolutely.
Oh yeah, I just get a few of those, those normal headaches. I get that back pain, but it's normal. I've been getting it for years.
Right. I hear that a lot.
There's
it's
nothing normal about
right.
a headache. There's an underlying cause. You weren't just born with headaches, unless you were born with a misalignment in your spine causing that headache. But people are, throughout the years, think that these things that have been going on are just normal, everyday occurrences. And I try to tell them that we're so much more than, again, back pain, neck pain, and headaches, that we want to make sure we go and prevent these things from ever happening. I've had patients that have had ringing in the ears for 30 years. 30 years. That's a long time to have ringing in your ears and not even think twice about it. And after a few specific chiropractic adjustments, they went back to their doctor and they go, hey doc, you know that ringing I've had in my ears for 30 years? Well, it's gone. You think it has to do with the chiropractic? They're going to they didn't tell me about this. They told their medical doctor. The medical doctor said, absolutely. If the only difference you've been doing is getting under chiropractic care now, then absolutely that
Right.
ringing in your ears that wasn't normal is now gone, and it's because of the chiropractic.
And you use the word normal, right? And that's why a lot of people think it's normal to get just 2 headaches a week, 104 headaches a year. That's normal. There's a difference between common and normal. This day and age, a lot of these symptoms are very common, but not normal. No symptom is normal. The body shouldn't just present symptoms on a daily basis. And so it's common to get mugged in Central Park, but it's not normal. It's not a good thing. And so it's important to differentiate the difference between something that's common and something that's normal and right.
Yeah, and that's why I'm glad that we do shows like this to educate the public about being able to live what is an actual normal life. Symptom-free is normal. It's not common. But that's what we as chiropractors, we strive to do. We want to make sure that we see our patients and we are looking for results. We want to make sure our patients are living a life to the fullest potential. That's what it's all about. I mean, if you're living your life to the fullest potential, you're living an overall better life.
One thing I'd like to point out and talk about too is that as chiropractors, a lot of us will take x-rays. You know, I have a very a high-tech dynamic or digital motion x-ray system right in our office. We can take a motion x-ray, see somebody moving their neck from side to side, see exactly what that looks like inside. So we can be very specific about where there's a problem, what we need to do, where there's restricted motion, where there's degeneration, where there may be pressure on the nervous system. And so getting checked is a great thing for someone to do. Even if they have symptoms, of course, there's already warning signs there. They know they should get checked. But if they don't, it's always good to see what your spine looks like. Just like most people will go to a dentist for checkups, to get their teeth clean, see what their teeth look like. So it's great for people to go to chiropractors. They don't necessarily have symptoms, to see what their spine is like for preventative maintenance.
Absolutely. I mean, so many people I talk to, they just say, "Oh, I'm not in any pain. I don't need to go see you. I don't need a chiropractor. I don't have any symptoms." And you just have to educate them the fact that, you know, the silent killers, the first sign of a heart attack is a heart attack. They had no idea that maybe the nerve leading to their heart had interference for the last 50 years of their life. And the arrhythmias of the heart, maybe the heart wasn't working, but they didn't even realize it. And then all of a sudden, I mean, you have athletes, marathon runners that, sorry to say, they drop dead right in the middle of a marathon. They're as healthy as anyone in the world. I mean, they're running marathons, 26 miles they've been running. They've trained for this, but they didn't realize that there's something going on inside that is not pain, is not a symptom, and they can't even feel it, and all of a sudden, bam, they're drop dead on the marathon floor.
So chiropractic care and checking their spine is just a great piece of the puzzle. People should eat healthy, exercise. With their normal medical care, chiropractic is just a great piece of the puzzle for some people that haven't thought about it to add in. They don't have to wait until they're crawling in the office to show up to get their spine checked. Now, do we see a lot of people crawl in the office and have great results? Absolutely. So don't get us wrong.
Sure.
If you do have pain and symptoms, chiropractic can have great results with all sorts of different problems and symptoms. But I'd like to say that we don't necessarily cure those problems, those symptoms, those conditions. What we do is keep the spine and joints healthy and aligned properly so that the nervous system can flow from the top down, inside and out, and the body can function at an optimum genetic potential.
Mm-hmm. That's what it's all about. I mean, like you said, we're not curing things, we're just making your body function the way that it's intended to function. You weren't intended to be born in pain or with these symptoms. Something has occurred, an underlying cause that's causing all these things. And I mean, if a chiropractor can go in there and it's simple, we just take I mean, we're saying it's simple. We've gone to school, trained for 4 years, just like a medical doctor. And all these things that we're doing is, you know, what we're trained to do. Go in there, find the underlying cause, correct it, so the signals can just flow the way that they're intended.
So how old should someone be when they start to take care of their spine?
Gosh, I mean, as soon as they're born. I mean, like the birth process alone. As soon as they are in the world. Now, I don't know what America is. It's 63rd in infant mortality. So as there's traumas that are happening during the birthing process, whether it's vacuum extractions, forceps, turning the head, pulling out. If you literally took a baby in the mother's arms that was just born, and we did to the baby what the doctor did to get it out, we'd be locked up. We'd be locked up and pummeled, stoned. All right, but at that time, there could be a misalignment of, more importantly, and you talked about the atlas being the top bone in the spine, choking off just a little bit of pressure on the brainstem of that child. If there's that pressure over the course of time, 2, 3, 4 years, might it express as allergies, autoimmune, asthma, enlarged heart, seizures, the things we're seeing now that are just on the rise? Yeah, and do we see these things, do we see the body rectify these things on their own when all we do is just go in and just release the pressure? Sure. Did we cure that? Absolutely not. We don't even have to take a history. We do, but if we didn't know, we're still going to go in the spine exactly where there's interference, make the adjustment, and back away.
I know that's something. Someone comes into our office with the very farthest thing from that. It's just their big toe, the farthest thing from the neck. Well, that's something that we check on all of our patients. We want to see how that very top bone, which is called the atlas, is lined up and how the body's functioning in that particular area. And that bone is named after Greek mythology Atlas, the guy that holds up the world. And if you see here on our model, this top bone holds up our world. We see that the skull sits right on here. These two little nubs here called the occipital condyle sit right in here on the shoulders. And the bottom part of the brainstem goes right through that atlas. It's the only part where the brain becomes the body. So it's the very most important area in the spine and in the body altogether, because that's where brain meets body. And brain controls everything in the body, so it has to go through that particular area. So we check that on everybody, whether it's kids, adults, seniors, anybody, to make sure that that atlas is in normal alignment, functioning at an optimal.
Absolutely. I mean, if that first bone is out of place, putting pressure on your brainstem, then everything below it is not going to be functioning. I mean, Christopher Reeves fell off his horse, broke that bone, and what did he end up with? We're talking about Superman ended up in a bed on machines to take care of his heart, his lungs, liver, everything to be able to function was now a machine because he broke that top bone on his neck, putting pressure right on his spinal cord, right on his brainstem. And then it just degenerated until he passed away.
And most people hear about him, Christopher Reeves, and how he had his accident and then he was paralyzed, right? Well, those nerves control the things we feel. So obviously he couldn't feel anything. He couldn't move his arms. He was paralyzed. But those nerves control, like you said, all of the organs. He had to have a pacemaker to keep his heart going, artificial respirator to keep his lungs breathing. He had to have insulin. His pancreas couldn't make it. He had to have dialysis. His kidneys couldn't function. He had a colostomy bag. He was catheterized. Bowels, bladder couldn't function. Nothing from that area and down could function. But if you even took an x-ray of him a couple months after his accident, the bone actually healed. But what would never heal was the permanent nerve damage that he developed there. So it's important to make sure we prevent injury, prevent damage in that particular area, because every single thing goes through that atlas area.
That's honestly why I ended up naming the practice I named. I threw the name family in because I just didn't want historically what I had previously done prior to was trained athletes. I didn't want to see just athletes. Do I want to care for athletes? Absolutely, but I want to see their children. I want to see their grandparents. I want to see, chiropractic is for everything with a spine. And human-wise, yeah, the entire family. I want to see families under care. There's nothing greater than seeing a family honor and share in being clear together and seeing them just come in. They're just a cleared family. They act differently than a subluxated family, I find.
And you were mentioning when the first time a baby should come in. I mean, you said when the baby's born. I like to look at it when it's in the mother's womb. I mean, we like to take care of in the practice a bunch of pregnant women as well, because the nerves leading into the placenta that's feeding and nurturing the baby while it's in the womb, if the mother's nervous system's not functioning well, the baby inside is also not going to get the nutrients it needs. So we're talking...
The nervous system is working for two people.
Yeah, we need even before the baby's born, the mother should be in the office getting checked to make sure that they're both functioning properly before.
Right. So thank you guys both for joining us today. We had Dr. Ruvayn Rubinstein and Dr. Tommy John. And I'm Dr. Adam Rodnick out of Commerce Township, Michigan. And this has been Ask the Chiropractor. And remember that God gave you the gift of life, and what you do with that life is your gift back to God. We'll see you next time on Ask the Chiropractor.